Introduction, Chapter 1, The Social Work Skills Workbook, Barry Cornier, Indiana University School of Social Work. This is voiced by Instructor LaShawn Bold, Associate Professor in Practice in the School of Social Work. The learning objectives are to describe the mission and purposes of the social work profession, discuss the concepts of social work skills and competencies, identify the phases or processes of social work practice, and identify the dimensions of professionalism addressed in the Social Work Skills Workbook. So we'll be reviewing Chapter 1 with these ideas in mind. Social workers work with families, groups, organizations, and communities. In this workbook, we look at students developing a strong sense of professionalism and proficiency in social work skills. The skills that are talked about in the whole workbook are skills that fit the mission, purposes, and the scope of the social work profession, are compatible with contemporary social work practice, they represent professional behavior, and are consistent with social work values, ethics, and obligations. The skills are also supported by research-based knowledge and fit with the core competencies as identified in the educational policies and accreditation standards from the Council of Social Work Education. Social work is a profession, and social workers adopt common professional values, and we adhere to a code of ethics. We think and study and advise and take action with our values and the code of ethics in mind. We exercise professionalism, which allows us to be effective in application of the social work skills. So an example would be when we are interviewing someone or talking with a client, we are using professionalism and our professional values and ethics in that interaction. This will help us be more effective and allow the clients to be more successful. We have a foundation of professionalism and social work skills. So our social work skills come from being professionals. The social work perspective, we reflect our perspective in our terminology that we use. So we refer to people as clients rather than cases, and clients receive assessments rather than being diagnosed. This would be different than, for example, when you go to a doctor's office and they refer to people as patients, or you're going to get a diagnosis. Social workers say clients rather than cases, and we assess our clients. Okay? We look for strengths and resources and abilities and competencies rather than focusing on problems and deficiencies and what's wrong with the client. We will pull out or seek to assess what the client's strengths are and how can they build on those strengths to improve their situation. We adopt helping processes that involve cooperation and shared decision making rather than prescription and coercion. So what that means is we work with the client hand in hand and allow them to determine what their goals are for our interaction and what their goals are for their situation, the end result of their situation, as opposed to social workers don't just come in and tell clients what to do. We don't just give advice. We don't just say, here's what I think should happen and what you ought to do, so go and do it. Okay? We don't do that. What we do is we work with them to determine what it is they really want and help them best meet that desire or that goal by allowing them to have input into what we're discussing. okay, and input into the plan. It promotes equal participation and mutual respect. We don't use our status to say, our social status or our professional status to say, well, I know better, so you should do this. We work more as a partnership with the client, although we may have a lot more information or knowledge than the client does because we have knowledge and experience and we understand the world in a way that maybe they don't. So we use our knowledge base to educate clients so that they can make their own decisions. Our mission is to promote social change and to facilitate empowerment and liberation. So we want to help people help themselves. So we're empowering them to hopefully have such a great result that they don't need to seek help anymore. Now, we know that doesn't always happen that way, but we want them to be so empowered that they're able to go and function and seek assistance as needed, but maybe they don't need to seek it quite as often or in the same manner. So we tend to view the person in the environment and the person and the environment or within their context as the basic unit of attention. So we're not just looking at the individual and saying, this is exactly what your personal issue is. We look at the person within the big picture. Okay, we're looking at them in relationship to their family relationships, their interaction with others, their interaction with their environment, where they live, who they live with, how all of that is functioning as well. And we recognize that their circumstances influence what's going on right now and their behavior. So we pay very close attention to those relationships and how that is working out with their current difficulty. We have two focuses. We enhance social functioning and we promote we promote and restore beneficial interaction between the individuals and society. So in other words, we're trying to help them navigate life. We want them to be better able to navigate their current living situation. So we view people as having first potential to change, that everyone has the potential to change if they want. We don't force them to change. If they don't want, they're not ready for change, then we can only provide the information that we have and allow them to make the decision. Our personal benefit and gain is less important than serving others. Okay, so we set ourselves aside so that we can help others. And preference is given to people with the lowest status, the fewest resources, and the least amount of power. Now that means a lot of different things. Okay, that doesn't necessarily mean that we only assist people in poverty. That's not what that means. But we do look at those situations with more of a focused lens, if you will. But we also understand that relationships are not just about financial resources. So we're not talking about just financial resources. Okay, you may have someone who is in a relationship where they have the least amount of power, but financial resources have nothing to do with that power, or they do, but it's not the focus of that. So it's really, we care for those who cannot care for themselves. All right, and we try to help them either understand how they can help themselves or locate resources that will help them. With the person in their environment, we understand the environment is the primary cause of their social issues. We do not blame the victim. So what that means is if someone comes to us and they have an issue, we don't say, well, what did you do? Or what was, you must have been at fault. You must not have been taking care of your situation or yourself. For example, if you are addicted, if you have an addict who's your client, you're not going to say, well, you just need to quit doing that. Okay. you're going to really look at how their surroundings are affecting what the outcome is there and how they're behaving. We are supported by research that highlights context, society, and the place where the person is living. It's really important for social workers to do a systematic evaluation where we look at clients within their systems, okay? And we try to provide feedback that will contribute to favorable outcomes for the client. So we really look at the big picture to allow us to give the best assistance to the client to add to the best outcome, okay? When we are talking with a client, we're helping them build their own critical thinking about situations. So we're allowing them to process through, what is this situation for me? What does it look like? And how do I want to improve the situation? And what are the things that I need to do to improve the situation? That's the way we look at it as social workers, from a systematic perspective. For us, we want to be competent practitioners. That means we want to be competent in what we're doing. So we need to have integrity. We need to have a highly developed idea of self-concept, that we understand who we are and how we think about things, and we understand what our prejudices are and our biases in situations, whether it's the person or the community, or what are we need to be able to recognize, where am I here? Where am I thinking here? When I'm interacting with somebody else, I need to be self-aware, okay? I need to have self-control and discipline. And we need to have expert critical thinking skills. That's why when you're in a class that wants you to take things a little bit deeper or write a little bit further, or you get feedback that your group interaction with each other needs to be a little bit more professional. These are things that we are doing to enhance your critical thinking skills abilities, to help you be able to process as a student everything all the way through, okay, through a situation. We need to be energetic and willing to continue learning all the way through life. And that means being able to take constructive feedback and learn from that feedback and make changes in ourselves from the feedback. Graduates of a social work program should be able to demonstrate ethical and professional behavior, engage in diversity and difference in practice, advance human rights and social, economic, and environmental justice, and engage in practice-informed research and research-informed practice. That means you need to base what you're doing on things that have been well researched, or practices, or modes of interaction at the workplace that is informed by research, not just made up necessarily by something that is not confirmed by social work ethics. You need to engage in policy practice, engage with individuals, assess individuals and families and groups and organizations, intervene, evaluate. I'm going to talk about those things in just a minute, but these are the outline of the core competencies from the Council of Social Work Education. It's important that you understand what they are. We have to be proficient in communication. We have to be able to assess problems. We need to be able to match client needs with resources. We need to be able to develop resources, and we need to be willing to change our social structures and interact in those types of change. Okay. This is the method to all all of the things that social workers do, okay? This is the planned change process. So we are actually change agents in the lives of people and communities and organizations that we come across. So here are the phases and processes of practice. So when you get out there, you're going to be a practicing social worker. And these are the phases of that. Okay? You'll be engaging clients, you'll be assessing the clients, intervening, and evaluating. Now, when you engage, before you ever engage with a client, you're going to prepare for that phone call or that meeting. You're going to be beginning a relationship with that client. You'll be exploring with the client what their issues are. And then you'll begin to assess the next steps, the next phases. So what is going on with the client? Assessments usually include lots of interviewing and getting lots of information before you actually make a plan. Okay? You may contract with the client that says, okay, here's what we are going to do. What do you think? Or with the client, you're going to process the next steps of how to help them. Okay? And in that, you may have a contract with the client where you and the client have agreed that these are the things everyone is going to work towards, okay, to meet the end goal. You never intervene or start your practice or start your intervention before assessment, okay? That's a big rule of social work. All social work must be assessed. You must take the time to think it through and assess what's going on before you intervene with the client. When you intervene, that's actually the work that you and the client are going to do. Some of these things might be coming to therapy and what you're going to implement in therapy. Some of these things might be in case management where, the client has agreed that they're going to go to a certain place and you're going to follow up and see if they went to that place and received the information that they needed or they accessed the resources that they set out to do. But this is the actual work that's going to be done, is the intervention. And then once the client has begun the intervention, throughout that time period, you're going to be evaluating, is this working? Is the client, going along with the contract and you going along with the contract? Is everybody, kind of doing what they're supposed to be doing? And is it time to end the interaction? Is it time to move on? Is it time for this client? And that's different at every agency, every place that you are, every human service organization is a little bit different in their engage, assess, intervene, and evaluate process. But as a social worker, you must follow these steps to be an effective, competent social worker. The skills you're going to be using. There is a defined set of cognitive and behavioral actions that are things that you're doing, and you understand the skills without saying, okay, I'm going to use this skill now. Okay, this is where we're going to be practicing in this class, where you will practice your values, your ethics, your obligations, your knowledge, what you know about professionalism. These are the skills that you're going to be, the areas of skill that you're going to be developing as you go along. So we looked at this too: integrity, self-control. You need to have knowledge, expertise, and self-efficacy. You need professionalism also includes having social support and well-being, critical thinking, and lifelong learning. There's some other levels of professionalism. It's diversity and difference, human rights, policy and practice. These are all things that you're going to be learning here at the university to get you to that point of professionalism. And that is the end of the presentation. And I hope that you found it helpful. And please be sure and ask your instructor questions if you have.